Hello, everyone, and thank you so much for joining us on this Facebook Live session, which centers on the topic of obesity. Indeed, today we're going to discover how it is possible for all of us to act against obesity. I'm your host and moderator for the session, Paramita Chatterjee. Now, this is a very special campaign that has been started by the Times of India in association with Johnson& Johnson, because if you take a look at the numbers in terms of obesity, that seems to be a pandemic in itself, not just in other countries, but also in India. So at a time when we are all tackling with this COVID-19 pandemic, it's important for all of us to be aware of other health issues, especially obesity. Because when one is obese, it's not just a case of being grossly overweight or being physically unattractive. It is actually termed as a disease, because when one is obese, you attract a whole host of other diseases as well. And that puts you in greater danger. Thankfully, now there are many options available. So the battle against obesity is not just one about willpower or eating less. Science has moved ahead. So let's find out more about the options one has to fight against obesity with our very special guest joining us from Coimbatore and Chennai. We've got some of the leading bariatric surgeons joining us today. Let me introduce them to you, starting with Dr. Praveen Raj, who's Director and Bariatric Surgeon at GEMS Obesity Center, which is part of the GEMS Hospital, Coimbatore. Thank you so much, Dr. Praveen, for joining us. And Dr. Raj Palaniappan, who's the lead director, who's the lead consultant and Director Institute of Bariatrics at Apollo Hospital, Chennai. Once again, thank you so much, doctors, for making the time, because these are indeed trying times for all healthcare professionals. So it's a pleasure to have you with us. Dr. Raj, let me start with you. Now, I gave a brief description about obesity, but what was most surprising to me when I began my research on this topic was the fact that obesity is actually termed as a disease and, not just a case of just being overweight. What's the distinction between a condition becoming a disease as opposed to, say, just a lifestyle disorder?
Okay, see, when it comes to weight scenarios, we always have scenario from underweight to what we call as a super obesity. There is something called as an ideal weight for anybody's body height, which includes your muscle mass, your bone, as well as a fat mass. With so much of calculations, we arrive at an ideal weight. So I weigh around 5'9", and my ideal weight is around 70 kilos. So what happens if I grow more heavier by around 8 to 10 kilos? So the metabolism will be a bit deranged, but none of the activities of the body will change because of the physical standards not being too overtly pressurized. But when you go beyond a stage, so beyond 10 kilos, 15 kilos, then the metabolism will come down, and metabolism again coming down also have some effect on certain hormones, and these hormones start functioning less, and that creates a change in the functioning of the body. That goes for a longer time, or if your weight increases still further, then that becomes increasingly getting depressed in their activity, and at one fine day they become a disease process, most commonly what we call as a syndrome X, sugar, BP and cholesterol. This is where we call
so let's just recap. So if I'm, say, my normal weight is an X amount, and as per my height, if I'm, say, more than 10 kgs overweight, more than that, then obviously that's termed as overweight. But something beyond that is when it starts impacting our whole physical metabolic being. And Dr. Praveen, let me come to you with that point that Dr. Raj is saying. Now, is there a black and white metric? How do I actually find out? Because, it might, even if I'm overweight, we've seen in some cases, so people look overweight. What we found surprising is that they don't consider themselves as obese. How do I find out when I have crossed that fine line between being overweight and being obese?
Yeah, see, I think the simplest variable would be the BMI, although that is actually scientifically, if you go deeper, that is not the right variable. However, for a layman's perspective, BMI is a simple cutoff to know where are they. Like a BMI less than 25 is normal, 25 to 30 is overweight, and anything more than 30 is considered to be obese. But as I just mentioned, BMI is not the only criteria. We also need to understand the composition in our body. See, many times there could be this weightlifters or the big time gym guys who could be extremely muscular, but BMI of 30. That doesn't really mean that they're 30 BMI and and they're actually bad. So we also need to look at the composition of muscle to fat, also to understand how is somebody is obese or how somebody is not obese. Wherein there is this in the WhatsApp, you might be seeing this called the string test that has actually been running. If your waist circumference, you need to take a string, first measure your height, make it into half, make your string into half, put it around your waist. If it is going to be smaller than that, then probably you're obese. You could be thin, which the point here is you could be thin or not so overweight or obese, but if you have a big tummy, that is again considered to be extremely bad. So which we need to look at, because that indirectly says you have a very high fat mass and a very less muscle mass. So that is an indirect variable to understand that somebody is actually bad or good. I mean, in addition to BMIs.
Okay, so we have the BMI, that's one tool, but go beyond the BMI. You're saying find out the proportion of muscle to fat, and you've given us this beautiful system of actually taking a string, measuring my height, and if I take that same length of string and put it around my tummy, if the circumference is actually more, then I have a problem.
Half of that.
Okay, half of that.
Yeah.
Okay. Obviously, it can't be more. Then I would be completely disfigured. So half of the string length, then I'm considered obese. So, Dr. Raj, let me come to you, because we are talking to you. You're based in Chennai, and typically India is such a diverse country. We see patients with different manifestations in different parts of the country, also linked to their diet and lifestyle. Typically, what do you see in patients who come to you in the region that you represent?
Okay, so luckily for me, being in Apollo Chennai, we get people from across the country coming to us. But to stick to specific to most amount of people who come from south to us. So basically, their lifestyle is about carbohydrate-based eating, less protein, and maybe more fat as well. As well as their physical activity is pretty low. Sedentary lifestyle is very common. Basically, for the last 2 decades, none of the schools, none of the colleges have much of a playgrounds and sports as their regular activity. So things have changed, because South is considered to be a hub of education. So everybody, including parents, concentrate on the kids' education. See, my parents stopped me from playing sports from 7th standard. They said no more sports. So that is how the South culture is. So lesser physical activity, more indulgence in calories, and less nutrition, because we stopped eating much of a vegetables and fruits, and it's all carbohydrate based diet. So most commonly what I see in the South.
Okay, I see. So we're eating too much of carbohydrates. That's what we're seeing in the South. Actually, not just in the South, in the whole country. Because Dr. Praveen, there are so many of us, myself included. We say, okay, from tomorrow I will eat just 2 teaspoons of rice, or 2 tablespoons of rice. Teaspoon again is too much, too little. So 2 tablespoons of rice, or I'll cut down 1 roti. These kind of steps. When we say that our Indian diet, typically, is there something lacking, or that makes us really predisposed to obesity?
Definitely. I think diet does play a role, but more than that, we now have a lot of data and evidence how ethnically by Indians we are actually born. I mean, I was just mentioning about the muscle mass versus the fat mass, right? We are actually born with higher fat masses and less muscle masses. This is as ethnically, you, me, everybody born in India, because that's how, because we have enough data that have compared with the Caucasians, and now we know that. So we are already genetically predisposed to obesity and diabetes and related complications. In addition to that, the dietary patterns that we have, which is a very high carbohydrate, or I would say not just carbs, very high glycemic carbs. Because rice, white rice, the polished rice that we eat, especially the southern part of India, has a very high glycemic index. Although the North Indians eat much chapatis or based out of wheat, again, which is carbs, but the glycemic index is lesser compared to what polished rice.
I have to stop you here, because as a good student, I have to ask you that when you say glycemic index, what does that mean?
Okay, glycemia means sugar levels in your blood. So more the glycemic index, higher the sugar level. That is why you end up eating a South Indian thali meal, you feel drowsy, you just want to go to bed. You end up
Right,
eating a chicken,
right.
you don't feel so, right? So that is that glycemia, that high sugar levels make you doze off. So this has
Absolutely.
a
No, it's
direct
not just
relationship.
in the south. I come from West Bengal, a very heavy
Okay.
rice eating, and it is a tradition actually to take a nap after lunch because lunch is so heavy. Dr. Raj, okay, taking that point there. So we have our genes which predispose us. We have more fat in our bodies. We have our diet. Um, is there something else as well? I mean, in terms of the mindset towards obesity, like for instance, in the West, particularly in the US, it is accepted. It is a major problem, and they are dealing with it. What's been the stance in our country? Is there a sort of denial about this very fact that we have an obesity pandemic as well?
Yeah, so there are three main factors. What I say, culturally, we are different than the West. What leads to obesity more? One is
Hmm.
good host, good feast culture. If you want to, make yourself feel that I'm a good host, you have to feed them the highest of calories. So
Hmm.
we are used to that. A good festival means it's only about eating. It's not about going out, not be playing, not about doing things. So culturally, good host is good feast. So that way we equate health and prosperity to food. That is one
Hmm.
big concern of what we have a problem is. Second is, as you said, the reason behind this denial, big time is nothing will come to me kind of an attitude. I know it's okay. Your neighbor has, your father has, your mother has, but still you say no, 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 nothing will come to me. Kind of a pure denial of, and then continue with the unhealthy kind of a lifestyle, both diet wise, activity wise. That's the second biggest thing. Third is
Hmm.
not getting a scientific or what do you call a professional help. We are a country of self-medicating ourselves. What we believe in, what our friends say, what our relatives say, but never on what doctor says. That's what they say. You eat all kind of a junk without seeing what is the label and so many things. But doctor gives a medicine, we'll ask what are the side effects. So that is how
Right.
we are. So we have so much of a problem with that. And the fourth part I want to say is, like what Dr. Praveen said, we are genetically made that way, but we also absorb less of good nutrients. We absorb less of B12, less of protein, less of microvitamins. So we need to eat much more of them to grab. We are 20% deficient in the absorption capacity of good nutrients. But
I
carbs and
see.
fat, we absorb just like that. So we have to be careful about what we eat as well. So as Indians, we should be eating less carbs, more proteins, and normal fat is the way to go forward.
Right. So clearly our diet is a big problem. I think all of us need to wake up to that fact because we've got our genes which are working against us. There isn't much we can do, but we can do something about our diet. So let's, cut down on the carbs, as you said, more vegetables and fruits and protein in some way or form. So Dr. Praveen, I want to also focus on the psychological aspect because as I said, there is a denial about the fact that we have this overweight or obesity pandemic, which is there in our country. So typically, when patients come to you, at what point is it they themselves who come to you? Is it because of family pressure that they come to you? What's typically the trigger or the catalyst that brings an obese patient to your doorstep?
Yeah, I think the problem is I would not say there's a denial. The denial is by the people who are not obese. The people who are obese understand they're actually going through a trouble because they are the ones who are
Right.
suffering. The problem is the
Hmm.
misunderstanding of those who are not obese who tend to believe even now that if somebody's obesity is directly attributable to their laziness, directly
Right.
attributable to their intake of food. So they end up giving this free advices. Why don't you cut down eating? Why don't you start eating small portions? Why don't you start walking? Why don't you go to gym? So indirectly, what really happens, they don't encourage them, they actually demotivate them because this is
Hmm.
just not going to work. Because most of the obesity in India, at least in my practice that I see, is not related to high caloric intake. They are all suffering from metabolic abnormalities where if you really compare them to a normal person who are eating or in the same family, unbiased, if you ask them to answer, they will actually tell you that they are the one who are eating the least in the whole family. So the
Right.
issue is
So
not about eating the calories. It's about the metabolic abnormality, which needs to be understood, which the non-obese need to think the one who's obese is not wantedly obese, is actually suffering. Who wants to be really obese? They are suffering.
that.
So they got to help them find that solution. So that taboo needs to go out. That this
So
it is laziness attributable to obesity.
I think that's a very powerful message. And to all our viewers who are joining us, I think that's a message that needs to go out. Stop treating obesity as a case of somebody who doesn't have willpower, because it's not in that person's hands. Dr. Raj, would you like to add into this? Because this is a very important point. Most, and this includes, I have seen friends of mine who are in that category. Suddenly they join the gym with great vengeance, with, if I may say so, disastrous results. Either their knee pops out, or it doesn't help. So, would you like to add to this aspect about the fact that obesity is a disease, and it's a disease that can't just be treated by the patient himself or herself?
Yeah, so I would like to have 3 points to explain this. Point number one is what we call the thrifty gene hypothesis. Genetically, we were a poor country for centuries together. So we naturally have tendency to absorb and store more. So when we try to eat, when the genetically you have more storing capacity, you eat less than a normal person, but store more. So genetically you have a tendency to store more. So this kind of a people, even they eat, I have people who eat only one chapati at a time, maybe 1/4 of what a normal person eats, and still they are 120 kilos. And because of, as what Praveen said, we are metabolically deficient in most of the times. We are 30% more prone to diseases. Diseases come early. So little bit of weight, little bit of issue, lot of your thyroid issues and polycystic ovarian disease issues, which are common along with it, you tend not to lose at all. One.
Right.
This is what we call set point theory. The set point theory again, the moment you gain 10 kilos, 12 kilos, your body capacity to hold on to the weight increases. So you will not be, it will be difficult for you to lose weight beyond a weight. When if you're 10 kilos overweight, it will lose 2 kilos, 3 kilos. If you're 20 kilos, you can still lose only 3 to 5 kilos. So that extra 15 is difficult to lose. So we have to understand all these things scientifically and approach accordingly. For that, we need to have a help from a qualified personnel to understand what kind of obesity you have, whether a high calorie obesity or a metabolic based obesity or low expenditure based obesity. Understand this and accordingly get yourself corrected. Just by diet exercise, you cannot lose most of the time.
Okay, I think this is again such new information that you have these different kinds of obesity. Metabolic means you have some underlying condition, which whether it's thyroid or polycystic ovaries, that's preventing you from losing weight. And it doesn't help that, we have a tendency of that thin fat body, which, has a tendency to hold on to weight. And the minute you start gaining more weight, then your body holds on to it even further. So it just becomes a self-defeating cycle. So, Dr. Praveen, let me come to you with this point, because our topic today is weight management options beyond diet and exercise. But, psychologically speaking, if I come to a bariatric surgeon, the minute I hear the term surgeon, that makes me very apprehensive. And then, one thinks of, these amazing videos on Instagram, which says, I lost 30 kgs. I was this and now I'm this. We are bombarded with these images. So, how do I break this cycle? Because when I come to you, what should I actually expect? Will you give me only a surgical option?
See, first of all, the misnomer is bariatric surgeons just don't operate. We are just not waiting with a knife to just insert to whoever's going to walk in. And at least in GEM, and I'm sure with Raj and many of the high volume bariatric surgery centers do have a holistic approach. We have our own psychologists, we have our own dietitians. In fact, in Chennai, I've set up my own gym where patients get a holistic approach. And we also, advocate medical therapies when and not possible with regard to weight for the other medical issues. So the question is, yes, we also offer the topmost end, which is the bariatric surgery part also. And a bariatric surgeon cannot practice without the basics covered. I cannot say either I operate or I don't. That is not the way. So we tend to give the entire aspect of it. We tend to look at what are the possibilities that we have to approach a patient. Is there a possibility that we can even address this obesity or the medical issues without actually a surgery? We try to cover that. But however, of course, 70% of the times patients who come to us have actually gone through the whole process somewhere else. Maybe at a gym, or maybe with the other physicians, or maybe with the dietitians. They come to us primarily for a surgery. So we end up doing more surgeries than non-surgical approaches. But when a patient The first time they come to us, when even we think that the patient is not eligible for a surgery because the patient is not motivated, the patient is having hypercaloric obesity, we tend to correct those factors. We don't jump to surgery, because doing a wrong surgery on a wrong patient is also difficult for the patient, and for us running behind the patient will be extremely difficult. So I think going to a surgeon should not be only for a surgery, but to look for the right approach, because generally teams like us, which we also do surgery, we will tend to cover the entire aspects. So that's the thing that patients need to look out for.
Okay, so just because you have the term surgeon attached, it doesn't mean you're not going to look at the cause, first of all, of obesity. After you've determined the cause, then you look at whether there are non-surgical options. And if those you have tried, then, you look at surgery. So Dr. Raj, when we talk about surgery, now the flip side of that is, I come to you saying that, listen, I hate the way I look. And here seems to be this surgical option. It almost seems to be like a cosmetic option, better than liposuction. How do you cater to that range of expectations from patients that, I will go from a size, 28 to a size 10?
Okay. So that is where, like Dr. Praveen said, we have our psychology team to assess what kind of a mentality they're coming to us with. Whether they're coming to us with a cosmetic intent, they're coming to us with a metabolic intent, or they're coming to the quality of life intent. So we take the quality of life intent seriously. Next is the metabolic intent, and cosmetic intent is the third. We work on cosmetic intent provided the patient is super obese, when they are 50 kilos, 60 kilos overweight. But not look into cosmetic intent when they are 30s around, where they are in the borderline of surgical and non-surgical treatment, because every treatment has its pros and cons. The pros has to outnumber the cons very strongly to recommend a bariatric surgery. Surgery is a compromise. So we have a cutoff. Beyond that, we will not recommend surgical option. So we cosmetic intent only in those lines. Whereas if there's a metabolic intent, they're highly uncontrolled diabetes, they sleep apnea, they're not able to sleep well, they have a kidney issue, they are getting into a failure scenario, or their quality of life is so suffering that psychologically they're so down, and they're not able to take care of their regular activities, severe knee pain, back pain, this kind of obesity, will take them much more seriously to improve the quality of life and improve the metabolic intent, which has to improve their life expectancy. Only then we look into surgery as an option. So our psychologist will assess this. Nutritionist will assess the nutritional part of things, like how their calorie intake is, how their expenditure is, and what are the issues they have with the nutrition. Then, as a surgeon, though we call us a surgeon, for example, a gynecologist surgeon doesn't mean that they do cesarean all the time. They do normal delivery as well. Same way, we also work on 70% of times on lifestyle management. Only 30% of times we work on surgeries in our own surgical group of patients who come for surgery itself. So we work on those options. Weigh these three options: our assessment, nutrition assessment, and psychology assessment. And depending upon where they stand, how much they stand to benefit, how much their quality of life and life expectancy improves, accordingly, we will talk to them, and knowing their mentality, we will play with them. That's how we do.
Okay. So basically, it's not a decision of the parents, of the patient, sorry. It is a decision made by a team of doctors who look at the entire gamut of, look at the complete picture before you decide on surgery. Because Dr. Praveen, when we talk about, surgery, what does it mean to me in terms of my lifestyle, in terms of also perhaps, some of the challenges that I may face? How is my life going to change post-surgery?
Okay. So I think these changes that is required post-surgery, see, there are changes that are expected that somebody has to follow. There are certain changes that will eventually happen. So there are two aspects to it. The first is the lifestyle changes that, as I've just mentioned to you, we would be choosing an option of surgery only when all the lifestyle measures are exhausted, or if they have practical difficulties like joint pains, etc., unable to walk, sleep apnea, where they cannot really properly do a proper lifestyle modifications, we would choose a surgery as such. But the changes that is expected from someone is a healthier lifestyle change, which includes right eating, right physical activities, right sleep pattern, and stress management, which needs to start even before the surgery. It should not be even thought of after the surgery. So somebody needs to build that foundation of a healthy lifestyle even prior to the surgery. Now, this is definitely expected on them because we're looking at a long-term weight loss. Post-surgery,
Right.
there are two important changes that anybody needs to accept to be, which will be part of the procedure by itself, which is they cannot be overeating at any point of time, which doesn't mean that they will be eating less. They would be eating
Right.
smaller volumes more frequently to match their nutrition needs. So the
I
smaller
see.
frequent intake rather than two big meals or three big meals that we do nowadays. Number
Hmm.
two, their overall appetite for food or the liking for food, there will be a difference because of the hormonal changes that these surgeries induce. So they may not like
Okay.
certain things that they used to like. They may like something which they never used to like. So they have to be
Hmm.
ready to this new appetite change. They need to be ready to this frequent intake. However, their overall interest for food also might be done. However, they need to be eating at the right times to make sure the nutrition needs are met. So these are two
Okay.
important factors somebody needs to consider.
Okay, so aside from the fact that physically I am going to see a lot of changes and I need to work with that, the fact is my stomach, because it has become physically smaller as well, I will have to eat much more frequent meals. Because Dr. Raj, there is this apprehension, especially now during COVID times, that these kind of surgeries also impact my immunity because I'm not able to eat everything or eat the kind of foods that keep me healthy. Is that a myth?
It is definitely a myth. Actually, bariatrics improves your immunity, what obesity doesn't have. I say normal person will have a good immunity. So you're comparing a post-bariatric immunity and a normal immunity, that definitely there could be some kind of a misnomer. But then morbidly obese will have poor immunity. Post-bariatric immunity improves without fail. And this
Hmm.
immunity will help you not only in getting your weight down, your liver immunity, your heart immunity, your lung immunity, as well as your kidney immunity, everything improves. So that's why I say life expectancy improves post bariatrics for the ideal candidates who deserves a bariatric surgery. So for
Right.
that matter, a patient on a borderline kidney failure, renal failure, borderline liver failure, borderline kidney failure, they benefit from doing the right bariatric surgery. Of
Hmm.
course, at the end of the day, a good nutritional replacement is very important to make sure the immunity is maintained. If the patient
Okay.
doesn't follow the nutritional pattern well and the patient already are compromised, then you're asking for trouble post-bariatric because the nutrition falls down more and immunity might be a
Hmm.
bit compromised. So, if
Okay, so you have to follow these new nutritional nutritional guidelines. You have to follow them because your body has undergone a change. Dr. Praveen, break it up for us between, for instance, for women, what are the major changes I can expect, and what's the biggest catalyst for women to undergo bariatric surgery?
In fact, predominant of the bariatric patients, at least in my practice, and I'm sure predominant of the practice in the country is actually women. And
Hmm.
the spectrum of women varies. You see a significant spectrum who come prior to their marriage, primarily because their alliances were getting delayed. They're actually come for a bariatric surgery. But more importantly, in the recent times, the big chunk that I'm starting to see is females coming with menstrual issues and PCOD related infertility problems. Significant of them, especially
Hmm.
nowadays incidence of polycystic ovarian disease, where they come with obesity, blackening pigmentation of the neck, hair growth on their face, or small ovarian follicles is quite high. Then these have like menses irregularities, like they have menses delayed for months together. And this
Right.
has been identified as one of the important aspects of primary and a secondary infertility. Primary means they never had a kid. Secondary is like they have one kid and then they're not able to conceive. So
So
nowadays,
actually,
treatment of obesity.
from what you're saying, the typical profile of a woman patient is somebody who's younger, who's trying to achieve a family, who is fertility is clearly a major trigger, right?
Absolutely, absolutely. So we see that very commonly nowadays, or probably with increasing infertility rates. I think you see infertility clinics all around you. A significant portion of these is linked to obesity and overweight, and that is a bigger chunk that we're seeing nowadays. Who are actually coming asking for a surgery or referred by the gynecologists themselves that it's better you look for surgical option or weight loss is a need for the hour. So that is the second spectrum. And the third important spectrum is probably elderly women where they're suffering from joint issues, early age onset osteoarthritis, the back pains that they have, or probably intervertebral disc prolapse that they come. So mobility issue is the third subset of patients that we see very often nowadays. So these are the three spectrum of females who actually come, and females still, and of course a large number of them who come for hernia repairs in our hospitals who are also obese, where we tend to combine hernia repairs along with bariatric surgery, is another chunk that we are seeing quite often.
So for women, it's primarily fertility when they are younger or trying to achieve a family. That's the primary trigger. And as they get older into their middle age, it's when they impact their knees and their back and so on and so forth. What about for men? What's the primary trigger there?
The major aspects has again been obstructive sleep apnea is one thing that has been completely ignored issue for a lot of them come with. If you actually see a lot of men, especially the days you used to travel by train, you will see this heavy snoring that would be coming. The snoring would stop for a while, then the body would vibrate and they will start snoring again. So we all come back and say, "Oh, night, my."
So snoring is a pretty universal issue. If that was the case, you'd have a huge rush of patients, or rather, women would be pushing their husbands out. I mean, is that a primary sort of
No. So we need to understand. No, it's not just snoring. These significant part of the snoring issues is related to a disease called obstructive sleep apnea, which means the weight that they have, the huge tummy that they have, presses on their lung, so that when they're actually sleeping, the lung is struggling to take in air. So the amount of oxygen in the carbon dioxide gets deranged. So they have a very, very disturbed sleep. And this has a direct impact on in fact, many of the obese people that you might have heard who have died during sleep is not because of a cardiac event, but because that the apnea means that the breathing gets stopped. So that the body is not able to recover. Exactly. So that's called apnea. So obstructive sleep apnea. Obstructive is blocking and apnea is stoppage of breath. Because not all snorings are sleep apnea, but a significant of them is sleep apnea. So in the daytime, they tend to sleep. Their productivity goes down. They're tired throughout the day. So the men are not able to really work well. So they just come to us not knowing the sleep apnea. They'll come to us telling, "Doctor, I'm very tired. I'm not able to work. I'm just sleeping off. When I'm driving a car, I'm tending to doze off." Then we go back and say, "No, you've been going through this." So this is one significant subset which I just thought the listeners should know, because most often we tend to laugh at people who are snoring so badly. We don't really understand that they're actually going through a trouble.
Yeah, absolutely. Because, you just mentioned something and it's bringing like a whole host of people to my mind who I know are grossly overweight. And I'm sure our viewers are also trying to make, trying to make that connection. Just taking this line of questioning forward. So a majority of women, infertility, men, sleep apnea is clearly, a big issue. So moving from there, once, but a lot of people might again brush these issues under the carpet, saying that I can delay these issues, that I don't need to come to a doctor yet. So, Dr. Raj, explain to us, how urgent is it when I suffer from obesity for me to address the topic of obesity, for me to actually go to a doctor and say, "Listen, I think my weight has just gone out of control and it's impacting my life"? Because for most people, they'll have a tendency to delay, especially now during the pandemic.
Yeah, so there are two issues which Indians need to, diseases which Indians need to be taking it more seriously. One is obesity, second is psychiatric illness. As a society, we should change our attitude towards obesity. Like what we have attitude towards fair skin, we also have some kind of a wrong notion about obesity. People's ego are stopping because they don't want to be body shamed, or they don't want to make themselves feel that they are not able to help themselves. Because if you seek help, they think that you are weak. So that is the kind of society we are living. So that denial has to go off. And second thing is, it takes 5 to 10 years for a disease to develop in an obese individual. So if you take this obesity seriously pretty early, we avoid a metabolic syndrome which is going to come later, and it's going to spoil your quality of life and your life expectancy. So we always tell our patients, first thing first, if you think you are gaining more than 500 grams a week, there is something wrong. If you are gaining more than 1 kg a week, seek help. That means average 4 kg a month maximum. 2 kg a month, you have to be cautious and take some steps to reduce either a calorie or increase your thing or change your lifestyle. If you are gaining more than 4 calories, you need medical help for sure. So have some basic knowledge about these things. Attend them. It could be a simple retention of water, but still a doctor should tell you that, okay, it's only simple retention of water. You do this kind of things, add these medicines here and there, you will go back. Instead, you gain 10 kilos, 15 kilos and struggle to lose those weight. And a rebound will be much more because your body is used to that weight.
I see.
So you have chance of failure more.
Point. So timing is very important. Timing is very important. The earlier you go, the more effective the surgery, the less a chance of other conditions complicating your case. And that rule of thumb is fantastic, that if you're gaining more than 4 kgs in a month, keep track of that. That means, despite all your best efforts, that means perhaps it's time for you to go to a doctor and, listen to everybody who's been giving you that advice. We will call it a day because, we don't want to take away from the impact of what both of you doctors have said. Dr. Praveen, Dr. Raj, many thanks for joining us. And I think it's been a really enlightening session because clearly, it is something that all of us need to wake up to. The fact is all of us are gaining weight in this lockdown. If you feel you're gaining too much weight, remember that metric of 4 kgs in a month. You can also do the string measurement, measure your height, and if half of that string length is actually your waist circumference, then you could be looking at an obesity issue yourself. So wake up to that fact. Thank you, doctors, for joining us. And that brings us to the end of this special session brought to you from Chennai and Coimbatore, Act Against Obesity by the Times of India in association with Johnson & Johnson. Thank you so much for watching.
Thank you.
Thank you.